Hello, and welcome to Five Things. I'm Dana Taylor. The Food and Drug Administration recently approved the first pill to treat postpartum depression, a condition that affects around 1 in 7 women in the United States. Health experts say zuranolone could be a game changer. The disorder threatens not only the well-being of the mother, but the entire family, and can become life-threatening. So what are some of the best strategies for recognizing, understanding, and dealing with postpartum depression? We're joined now by Julie Lamppa, a certified nurse-midwife at Mayo Clinic and mother of 2. Thank you for joining us, Julie.
Hi, Dana. Thank you so much for having me. I appreciate it.
Postpartum depression has at times been dismissed as baby blues or simply attributed to the hormonal changes that come with childbirth. So what is postpartum depression and how does it differ from normal emotional adjustments after childbirth?
Yeah, that's a great question. So it is very true that postpartum, baby blues are kind of labeled to include the up and down emotions, mild symptoms of depression within the first couple weeks after having a baby, usually within the first 2 to 3 weeks, and that actually is experienced by about 80% of women. So it is a really high volume. And then how we kind of distinguish the difference between um, the baby blues and postpartum depression is the length of time that you're experiencing it and also the time frame. So postpartum depression is defined as depression that is occurring within the first 1 year after having a baby. So the first 4 months is the highest risk time, but people need to be aware that anything within the first 1 year of having a baby would be labeled back to that postpartum time frame. So that can be really surprising for a lot of women and that they don't relate, the two things together. There's a lot of other postpartum mood disorders that are more so even related to anxiety, to OCD behaviors, to PTSD.
Pregnancy is a situation that's ripe for anxious thoughts. Postpartum depression was described by one mom as something that can make all of your choices feel high stakes. Who's an ideal patient for medication?
The highest risk patients for perinatal mood and anxiety disorders or postpartum depression are those who have history of depression or history of postpartum depression. Other ones would be, you're in a situation where you're pregnant or postpartum and you don't have a lot of support from your partner or from family or from friends, kind of social isolation, kind of the extreme ages of childbearing can be a risk factor. So, greater than 40, but also, teens and early 20s. We might want to consider counseling during the pregnancy. We want to maximize mental health as much as possible during the pregnancy to set us up for a really good postpartum experience.
So, what are some of the potential underlying causes or triggers of postpartum depression? Something that's easily dismissed, like sleep deprivation, just a change to your daily schedule. How do those play a role?
There's the feeling of aloneness. I mean, we're still needing to really talk about postpartum depression a lot in order to get it kind of more mainstream and so people don't keep it to themselves. So a lot of times people just feel really isolated. And then with depression in and of itself, you sometimes want to isolate, and then that is going to kind of cycle things backwards, and just where you're kind of blocking people to come in into your world to kind of to recognize and to help.
And then certain strategies are only effective if they come in time. When postpartum depression has gotten to the worst place, it can be as serious as suicidal ideation. What do you want mothers to know?
Yeah. I think the most important thing is just really giving women the encouragement and the permission to please share what they're feeling, sharing what they're thinking with their partner, with family, with friends, with their provider, because they are not alone in this battle. And we want people to be aware of suicide hotline numbers, 988 to call. Postpartum Support International also is a really, really, really nice organization. You will get lifted out of this, but it's hard to do it alone, and people are going to want to help you.
Well, in postpartum psychosis, it's less common, but obviously more severe. Earlier this year, a New York oncologist fatally shot her baby and then herself, tragically. What are some of the distinguishing characteristics and emergency signs of this condition, and how do they differ from signs of postpartum depression?
Postpartum psychosis oftentimes will happen to women who also have had other kind of psychiatric diagnoses before. That's a risk factor. Um, I I had mentioned, postpartum OCD earlier, and I kind of want to distinguish those two because there's some similarities, but certainly many differences. With postpartum OCD, obsessive compulsive disorder, there is a lot of these intrusive, ruminating, disturbing thoughts that enter your mind. And for example, a mom holding her baby may feel worried walking into the kitchen and walking by the drawer of knives because she has a ruminating, disturbing, intrusive thought of grabbing the knife and hurting her baby. Some have shared that they're, afraid to go and walk by the stairs because they're afraid that they're going to, fall down the stairs and hurt themselves and hurt their babies. And then also maybe have the classic OCD behaviors of you know cleaning and obsessive worrying about their baby. But the difference between postpartum OCD and postpartum psychosis is that with patients with OCD, they understand and completely recognize the fact that the thoughts that they are having are not real. They would not hurt their baby, and they're disturbed by them. And then the difference with psychosis is there is that disconnect and that not understanding and potentially following through. And you're right, thankfully it is a very, very uncommon finding.
Well, let's talk about some of the fears that keep someone from sharing the feeling that something is off. The fear of maybe losing your baby, worrying that there's something going on with you that can't be fixed. How do we move past the stigma of postpartum depression?
Yeah. I think talking about it, exactly what we're doing today. I mean, I think that that's the biggest thing. There's just this overall stigma that I'm being a failure as a mom, that I can't handle the normal stressors of being a parent, that people are going to judge me for not loving having my baby and loving having, being a mom. And all of that contributes to it. And it's just depression, I think, is and mood disorders have just always been stigmatized, I think, forever. And it's really good that we can talk about it.
Well, should you think about that going into pregnancy? I mean, you want to think about all of the good things going in, but is this something to consider before you get very far along in your pregnancy? What would I do if this were to occur?
Yeah. 100%. And especially if you yourself have risk factors, like history of, depression, sometimes even family history, can put you at increased risk. But yeah, I definitely think that it's a good thing to kind of just head off from the beginning. And that's, again, talking with your provider about it. But even probably equally as important is talking with your support system around you. So your partner, family and friends, and actually like setting up a plan. All right, baby's going to be born, around this time, and kind of setting up your support system. I need, you know, my mom to come and live with us for 2 weeks, and then your mom come and live with us for 2 weeks after that, and just kind of setting everything up to be as successful as possible. For people who don't have close families, postpartum doulas, are a potential to come over, and not necessarily for that emotional support, but just to kind of help with other things. And really just being, sometimes the people around you notice mood changes quicker than you do yourself. And so if your partner or your best friends, your closest people to you, have that set, know ahead of time. Yep, I know that like Julie has already told me that she's, worried about this because we've talked about it during the pregnancy, then they're going to be at heightened alert for it as well.
Well, Julie, was there a time when women were institutionalized for experiencing these symptoms? Why do you think it took so long for medical professionals and researchers to really study postpartum depression more extensively?
Hmm. Yeah, I definitely think people were institutionalized. It's been several years now that I've, contributed to articles and such about postpartum depression. And when my mother read my first article, the next time that I talked to her, she said, "You know what?" She's like, "I think that I had postpartum depression." She said that I knew that something was wrong when the food wouldn't go down. And so when we talk about other kind of symptoms, sleeping too much or not sleeping enough, not being able to sleep, eating too much, not being able to eat. And I'm sure that she had multiple symptoms, but that was when she realized that something was wrong. And then when she went to talk to her OBGYN about it, he told her, you know, women are not supposed to have, 4 babies in 5 years, which she did. And, this was 60 plus years ago, right? And so that awful, self blame, right?
Well, as conversations surrounding postpartum depression evolve, what help is available to really help women process or handle those misplaced feelings we talked about, feelings of guilt that they've somehow done something wrong?
Do all the things when you're having problems with postpartum depression and anxiety. Nutritious eating, getting adequate sleep, so problem solving that to be able to sleep in the mornings or sleep through a feeding at night, spiritual care, getting outside, getting exercise, all of those things are really, really important. And those self care things should be done regardless. And then supplementing on top, counseling as needed, cognitive behavioral therapy just kind of helps retrain your thoughts into, more positive energy and how to cope with anxiety and depression. And then, utilizing medications if needed.
Julie, thank you so much for sharing your insights with us.
Yeah, thank you so much.
Thanks for watching. I'm Dana Taylor. I'll see you next time.